Butalbital is a barbiturate drug used for symptomatic treatment of tension-type headache in various combinations with acetaminophen, aspirin, caffeine, and codeine. In this video, let's find. What is Butalbital? What is Butalbital used for? Contraindication. What are the side effects of taking Butalbital? How does Butalbital work? How to use Butalbital? What is Butalbital? Butalbital is a barbiturate with an intermediate duration of action. Butalbital is often combined with other medications, such as paracetamol or aspirin, for the treatment of pain and headache. The various formulations, combined with codeine, are FDA approved for the treatment of tension headaches. What is Butalbital used for? Indicated for the management of the symptom complex of tension, or muscle contraction, headache, when other non-opioid analgesics and alternative treatments are inadequate, in various combinations with acetaminophen, aspirin, caffeine, and codeine. Contraindication. Butalbital is not recommended as a first-line treatment because it impairs alertness, brings risk of dependence and addiction, and increases the risk that episodic headaches will become chronic. Side effects. Commonly reported side effects for Butalbital, some of which tend to subside with continued use, include dizziness, respiratory depression, impaired breathing, drowsiness, intoxicated feeling, lightheadedness, nausea, sedation, euphoria, severe impairment of judgment, diarrhea, memory loss, constipation. Pharmacodynamic. Butalbital is a short to intermediate-acting barbiturate that reversibly depresses the activity of excitable tissues, including the central nervous system in a non-selective manner. Barbiturates exhibit muscle-relaxing and anti-anxiety properties, and they are capable of producing all levels of CNS moderation from excitation to mild sedation, hypnosis, and deep coma. In some cases, an unwanted paradoxical response of excitement may be observed instead of sedation with barbiturate treatment, which may be due to their depressant effects on inhibitory centers of the CNS. While Butalbital is expected to mediate similar actions as other members of the barbiturate drug class, the effects of Butalbital in isolation are not well understood. It is suggested that Butalbital is added in combination products to antagonize the unwanted central stimulating effect of stimulatory ingredients such as caffeine. Butalbital increases blood pressure and heart rate when administered at sedative and hypnotic doses. Mechanism of action. Butalbital is a CNS depressant that suppresses neuronal excitability, impulse conduction, and the release of neurotransmitters, similar to actions of other barbiturates. Barbiturates primarily mediate suppressive actions on polysynaptic neuronal responses by diminishing facilitation while enhancing inhibition. Inhibition occurs at GABAergic synapses that express GABA receptors, which are transmembrane chloride ion channels that bind an inhibitory neurotransmitter GABA, barbiturates, benzodiazepines, neurosteroids, and ethanol. Upon activation, GABA receptors allow influx and K plus efflux into the post-junctional terminal, resulting in inhibition of the postsynaptic neuron. It is suggested that barbiturates, including Butalbital, enhances GABA binding to the GABA receptors by binding to the alpha plus/beta minus interface in the intracellular domain (ICD) as a steric modulator. Additionally, barbiturates promote benzodiazepine binding to the receptor. Barbiturates potentiate GABA-induced increases in chloride conductance and depress voltage-activated calcium currents, while prolonging the duration of GABA-induced chloride channel opening. Butalbital may also inhibit the excitatory effects mediated by AMPA receptors by reducing glutamate-induced depolarizations of the receptor. It is also proposed that barbiturates and opioids may potentiate the analgesic effects of each other when co-administered, although there are inconsistencies across preclinical data. Half-life. The plasma half-life is about 35 hours. In a study of 5 healthy volunteers receiving 100 mg Butalbital in combination with aspirin and caffeine, the mean plasma elimination half-life of Butalbital was 61 hours, with a range of 35 to 88 hours. Dose. For tension headaches. Adults and children 12 years of age and older, 1 or 2 capsules or tablets every 4 hours as needed. However, the dose is usually not more than 6 capsules or tablets per day. Do not exceed 4 grams, 4,000 milligrams of acetaminophen, Tylenol, per day. Children younger than 12 years of age, use and dose must be determined by your doctor. Safety advice. Butalbital has been assigned to pregnancy category C by the FDA. Barbiturates in general have been reported to readily cross the placental barrier. Withdrawal seizures have been reported in a 2-day-old infant whose mother had taken a Butalbital-containing drug during the last 2 months of pregnancy. That's all the information about Butalbital we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.